good afternoon. Thank you for joining us today for the Wednesday edition of our Boston Healthcare Technology User Group. I'm very excited today. We have a great presentation. We're going to continue to talk about some cloud for healthcare, industry cloud, and provider services. Should be an interesting chat, and we've got a great guest today as well. So just a quick statement about our mission. So the Boston Healthcare Technology User Group, you're in the right place. We meet at a minimum twice a month. We meet every other Wednesday. I think it's the second Wednesday and the fourth Wednesday of each month. Our schedule is posted at bosshug.com. So if you go to bosshug.com, there's a link tree that has a link to our meetup site, our schedule, a link to request to speak, a link to our Discord group and the work that we're doing in the community. And so again, our mission essentially is just to create an environment where people have a shared interest in healthcare technology can meet and share ideas and listen to great speakers. Again, we're excited about Brian Spoker, our guest that we have today. And so we encourage folks to join our Discord server or mailing list. Again, probably the best link to remember is bosshug.com. That'll actually bring you to a link tree where you'll have access to all of our resources. And then also just note the Discord URL as well. There's quite a few resources in our Discord server. So that's Discord //healthcare. So again, Boston Healthcare Technology User Group. We like to say we're a local group with a global presence. And as a matter of fact, I'd like to add one thing. We have decided that all of our meetings going forward will be streamed. Again, in an effort to hold true to our mission of being based locally but servicing a global audience. But that said, we do plan on returning to in-person meetings. And so we're actually slated to do that starting June 22nd. So we're really excited about that. We'll be providing more details soon, but it'll be the meetup will be in person here in the Boston area. And again, we'll stream, the 30-minute session and speaking event so that folks all over will have access to it. And if you're in Boston and you can attend, that will be amazing. So our agenda for today, we're going to do I'm going to do a quick introduction to the topic and our sponsor, our company, Real Activity. And then we'll do an intro to industry cloud and healthcare and talk about Power Platform and Microsoft Cloud for healthcare. And Brian Spoker from Dartmouth Hitchcock is joining us today to talk about intelligent provider services. And so essentially what we want to do is talk about how we can bring these things together for the greater good of provider or physician services. So my company, Real Activity, is sponsoring the event today. So you can read more about us at realactivity.com. We focus on industry cloud for healthcare and critical solutions, mission critical solutions, and based here out of the Boston area. Thanks. Okay, so today's topic, it's a sort of a co-presentation, if you will. Brian Spoker's joining us today as well. And so I'll actually start things off. What we're going to do is talk about the title for the session today is Intelligent Provider Services and the Microsoft Cloud for Healthcare. Now, one thing I'll point out up front is that it might be worth noting that in some organizations, they'll refer to provider services as physician services. So if you're familiar with one term, if you're familiar with the term physician services, you can essentially swap that out for what we're talking about here in using the term provider services. But essentially the idea is providing resources for providers or physicians, if you will, so that they can sort of have an optimized workplace, if you will, and can focus on their job, right? And so that means multiple things. It means one, having people resources, that are in place that can actually collaborate and answer questions for providers and physicians, but also doing things like helping them maximize their productivity, helping them maximize their revenue, their salary, right? Essentially doing everything that we can do to make it easier for them to focus on what they do best, which is helping people be healthy and save lives. And so that's just a little bit on definitions as we go into the presentation here. So what we'll be discussing today is how to enable physician or provider services and how to do that in the context of industry cloud. So we'll focus on the Microsoft Cloud and integration with the Microsoft Cloud for healthcare and this idea of building provider services on top of a platform like the cloud from healthcare. But it is worth knowing that these are general concepts that we'll be talking about today. You know, we're not doing a deep dive into the technology as much as we are doing sort of an overview of the platform and the architecture. And I think it's safe to say that you could swap out your underlying industry cloud architecture, whether that be, you know, Epic or Cerner, or even Salesforce, now Oracle, right? These vendors have industry cloud solutions. You know, being a Microsoft partner ourselves, we just tend to do most of our stuff is with Azure and the cloud for healthcare services. So for us, it's much easier to have our examples centered on the Microsoft Cloud for healthcare. So when we talk about provider services, now Brian's going to actually dive into the business side of provider services. But remember, I had stated that it's provider services is a broad sort of definition, if you will, right? It means bringing resources of several types together to help optimize your physician workforce. And so what I mean by that is there's actually people involved, right? You may actually have somebody in your organization that's assigned to provider service or physician services, or maybe this is something you're looking at doing now, you know, in this transition that we're going through with hybrid workplace, you know, focusing on optimizing the workforce for your providers. And so in that case, you know, there's a collaboration component. And so when we're looking at the cloud for healthcare and integration with provider services and that collaboration with providers, it makes sense, and you can think that that a lot of that's going to happen at the integration with your collaboration suite, right? And there are many SaaS collaboration suites here, and in Microsoft land, that would be Microsoft 365 and Teams and SharePoint and the collaboration software, right? And being able to actually, again, collaborate with the providers. But then there's certainly a data component, right? One of the ways to provide a win-win between providing, a great workforce for the providers, but then also allowing the organization to reap some of the benefits of this is to provide some great analytics on top of the provider services data. And so one of the stacks that we have available that we can use for reporting on any data that we collect from our providers, include things like Synapse services, the Azure Healthcare APIs to integrate with Epic. This is important when we start talking about RVU data, which is something that's really important for providers. They're tracking their clinical time and their RVU data. We'll need to integrate with the electronic medical record, and so the FHIR APIs allow us to do that. And so if we look specifically at now we put some brands to the cloud for healthcare. You can see that, or brands, technology stacks. I guess you could use in this case you could use the terms interchangeably. But my point here is that the bulk of the cloud for healthcare is built on top of Azure, and then on top of that we've got GitHub, Power Platform, Microsoft 365, LinkedIn, and more. Right, essentially the ERP suite. Microsoft Dynamics 365 in the upper right-hand corner is extended, and that gives us the cloud for healthcare right at the top. You can see, and so the interesting thing here is that when we start to collaborate with our providers, we start to collect data, and we'll talk about this actionable data and what we can do with it. Then what's interesting is we can start to share that throughout the organization, using the different platforms that you see here. And so with that said, I think what I'd like to do next is turn this over to Brian so he could talk a little bit more about the specific business aspects or the business details of provider services as it relates to a healthcare organization. And then we'll come back and tie it into the technology again. So Brian, with that said, I'm going to turn it over to you. And I guess it's a tough spot to pick up. It's never fun to pick up after the dry technology slides, if you will, talking about but I've built a framework. I know you've been watching in the backstage here. I've explained to people how, from a technology perspective, we're looking at use cases where we can use industry cloud to optimize provider or physician services. And with that, I'll turn it over to you to talk about provider services more. Thanks.
All right. Thank you, Paul, and thank you to everybody who's watching in the Boston Healthcare User Group. Appreciate the opportunity to go through this case study. A little bit about myself. I live in northern New England and New Hampshire specifically. My wife and we actually have 5 kids who live here in this area. I've worked for Dartmouth Hitchcock Health now for 12 years, mostly around data, with the physician population and all that. So it's been a great ride. As you know, healthcare is an exciting area to be in right now. But let me walk you through a case with the provider services. So on the first slide, and excuse me, I don't think I'm seeing, there we go. Next slide down, please. This is our home web page for... Right here is the home web page of provider services at Dartmouth Hitchcock. Let me give you a little bit about Dartmouth Hitchcock. Dartmouth Hitchcock is an academic medical center located in New Hampshire. And because of our rural area, it makes us the primary resource for healthcare in our area. We have the main academic medical centers, a couple community group practices, and also several other smaller hospitals that are in our system. I'm going to read through the definition of our provider services group as it was started really about 10 years ago. It says the provider services is a centralized business intelligence repository of top drawer provider analytics, tracking and reporting the provider's non-clinical protected time in a concierge manner to operational leadership, individual provider, and the Dartmouth Hitchcock senior medical leadership. There's a couple things in that statement that I think will be of interest to this group. One, we set out to really be a centralized business repository. And that was partly because we found that provider data was across the organization, but was in various different departments. So something as easily as what is a provider's clinical FTE, you actually had to go to the provider's home department to be able to find that. So rather than having a single source where you could say, how much time do our primary care physicians spend on clinical, and how much time does our primary care physicians spend at another one of our hospitals in clinical? You had to go to both the home department and the organization to be able to figure that out. So we made a centralized business repository to be able to do that. The second part of that sentence really is the top drawer provider analytics. And so we were able to get the data into a dashboard where we were able to track it and be able to show it across the system so everybody could see at the same time. On the second slide, the thing I'd like to point out is the orange bubbles or oranges at the top of the slide. And this was really the data we started to track. So what you have when you're looking at the ERP in a healthcare system is, of course, you have the provider's full FTE. That would be their benefited FTE, their full employment, what they earn pension or retirement on. They're a 1.0 employee for the healthcare system. But then they do all these other pieces, which are in the orange circles, in addition to their clinical FTE, or as part of their full employment, but not part of their clinical FTE. So I'll give you for instance. If I took a microphone and walked down through the streets of Boston and I said to people on the street, hey, what do physicians do? I bet you 99% of the people who I asked that to are going to say, well, they're my MD. They're going to help keep me healthy. They're going to save people's lives, which is a very good answer. And obviously the correct answer that pops into everybody's head. But physicians also work on a vast amount of other things that would be non-clinical or non-clinical protected time. For instance, one would be contracts. They will work on contracts with other hospitals. They'll take their services to other hospitals and be able to help perhaps a smaller hospital provide a service that they wouldn't have the entire ability to be able to do by hiring a complete physician. They also work on things that are under their discretion. So that would be special projects. That would also involve, research they wish to do for themselves. A&S stands for Administration and Supervision. So these would be physician leadership positions. So like a physician who is a section chief or a medical director, meaning that, the section of medicine would have a physician who is the leader over the other physicians in that. That would be part of their administration and supervision time. Then you have grants. So this would be research that comes from the National Institute of Health, for instance, or perhaps in our case, the state of New Hampshire or the state of Vermont. We have cost shares. Cost shares is work that is also in the grant space, but is where we're sharing some of the costs of the research. There's funds. Probably the easiest one to think of that for the general public would be like a donor fund. So a donor says, I want to support cancer research for kids. And that fund is worked on and time is spent on it. The last one is GME, which stands for Graduate Medical Education. This would be physicians who are attending to resident physicians. So when you go to an academic hospital or a teaching hospital, that physician is being shadowed by a resident who's learning the tools of the trade, for instance. So those orange circles in the top are things that make it hard to understand or that need to be tracked so that you understand the delta in between the provider's total FTE, they're a 1.0, and their clinical FTE, they're a 0.5. Well, why are they a 0.5 clinical? It's because they are working on different sections of this. They may be working on administration, supervision, grants, cost shares, whatever. Once we are able to track that data, then we're able to put it into a single platform. I'm not going to spend much time on the middle part of the slide where we talk about the provider experience platform, real activity, and that sort of thing. That'd be a great topic for another one of these lunch and learns. But you notice that once we have that data, we can do a lot of things with it. We answer a lot of compliance concerns. So this would be Medicare Part A. Medicare is how, obviously, how the hospital gets reimbursed for some of the services from the federal government. Medicare is federal government. NIH reporting, National Institute of Health. They want to know, for instance, are your physicians working on the grants that we've awarded them? And since we track that in one of the orange circles above, we would certainly have that. We're also able to produce external billing. So it works in the idea of a receipt. A physician will say, yes, I'm working on this, and we can produce billing out to the external party to be able to sign. Notice also under the clinical FTE column that we track all the hires, terms, and leaves through the systems. We track per diems. So that would be providers who come and only work as, part-time employees. They might work 2 hours 1 month and 20 hours the next, backfilling for vacations or maternity leaves or any type sort of leaves, sick days for other providers. We have variable contracts where, another health system will say, hey, we need help for a short amount of time. Can you send one of your providers to help us? We also have provider metrics that we track very carefully. I'm going to pause on just that box for just a second. That's the third box down in the middle box under clinical FTE provider metrics. Once we have a clean clinical FTE, we're then able to match it to, a health system can then match it to the work RVUs, or you'll say the amount of appointments made would be the easiest, amount of patient encounters in lay speak that a provider has to be able to see where they are at compared to benchmark to their peers. That leads into benchmarking incentives. Those two boxes right there are really their own one of these meetings to be able to discuss, exactly how we get to the clinical FTE, exactly how work RVUs match with that, exactly how benchmarks and incentives work. So I'm not going to spend a lot of time on those boxes right now. But for those of you who are in healthcare, you understand what I'm saying, that with an accurate clinical FTE and obviously accurate patient encounters, you can see benchmarkings for an individual physician, their section, their business unit, regardless of which hospital they're at, and then also the overall department underneath your health system umbrella. The final piece is operations and finance. We do a lot with research management. As you know, all grants are tracked in this system. We do a lot with the wage index, which comes to the Medicare cost report as well. Those are kind of the bullet points of what we do in provider services. And again, the idea is to be able to take all your physician data across departments, across locations, even across states where providers are working, and across your technology stack, and be able to bring it into one single location where you can do the analytics on it and you can understand it. Here's examples of actionable data that we do. One, we have a single source of truth for clinical activity with internal partners such as finance, HR, provider services, quality metrics, and more. So again, it comes to that point of getting to the single source of truth. You're reaching across your technology stack. You're reaching across your geographic locations. You're pulling this data all in a single manner into a single source where you can understand it. That's very valuable for senior leadership as they make business decisions. Second is you can enhance governance, compliance, management oversight, and reporting to the federal government. Again, once you have this data in a single location, then you can, I'll call it mine it, or you can pull it as you want to, as you see fit, right? So there's pieces of management oversight that you don't need the massive data set for. You just need a certain subset of that data. But since you have it in a technology data set, then you're able to pull it to be able to produce the data that you need, which is the next action item, which is data that allows the health system to drive efficiency and optimize the provider workforce. Obviously, a provider who works at a large academic medical center works a little bit different than a provider who's at a small hospital. Those are very similar jobs, but they're different in ways as well. So with this data, then you're able to see that. You're able to see those differences, the results of the differences, the business decisions that will help support both providers and really optimize that provider workforce. The final one has to do with the industry cloud and the 360 view that we have with the data. So again, if there's a key takeaway that I can leave you guys with in this presentation is with the beginnings of our providers, or with the creation of our provider services location, we are able to take a physician data that is across platforms and occurs across geography and pull it together into a single business location where we can support business decision and analytics. So hopefully that was a great way to be able to, show
Yeah, that was really amazing, Brian. I think,
Turn it-
I probably should have started this with it, and I think you touched on it briefly, but I just want to add to it a little bit more. I want to talk about the different types of data that we're talking about tracking for the provider services here. Maybe just to help make it a little more clear to folks that are listening in, right? So, I think one of the key pieces of data that we I don't think one of the keystones to the data that we track is the what we call provider attestations, right? Where providers are actually attesting to how they spent the last 30 days, right? And so they do this not by typing in hours or anything like that, but essentially, we're able to pull from disparate sources around the institution, right? The grant system, the contract system, PeopleSoft, or your ERP system, whatever that might be, right? For in some cases, PeopleSoft. If you're using Microsoft, you might be using Dynamics. But when we pull this data together, we're able to create a form where we can send to the provider, where essentially we have a pretty good idea of what they're working on, right? The students they're teaching, the department they're running, all the various things that they do throughout the day, minus the clinical time, which is the part that's important to the hospital, right? That's what we're trying to get at here. And so I just wanted to just, highlight that a little bit more and bring it back to the technology side, if you will, So,
Yeah.
can you think of any other data sets, or can you add to that a little bit? What are your thoughts?
Yeah, I was just going to say the technology of the physicians to be able to see a single form once a month, in our case, once a month, where they are laid out exactly what work they have done, and they can confirm that, and they're able to do that in 30 seconds or less. and that go back into a master data set that we then know is gospel, I'll call it, because the physician has actually attested to it, gives us then the data set we're able to make the right business intelligence decisions, right? So you're right that the key is that we track this data, it's presented to the physician physician confirms it, and it then comes into a master data set that we can use. It was interesting, the other day I was actually looking at the amount of verification forms that we've had, and we've actually tracked over 250,000 signatures with over 500,000 roles. That's pretty amazing.
Yeah.
And so once you have a 10-year data set like that you can look back and you compare, where has my business been, where is it now, and where is it going in the future, it's very valuable. And you know that data is correct because the physician has attested to it. So that was important. Thank you, Paul.
And the other opportunity there is turning it into actionable data, right? So you're right. I mean, once you have this a solid data set, then you can start to add machine learning algorithms on top of it as well, where you can start to do some interesting things with predictions. So yes, it's fascinating all the way around. That's why I love this example, because it really shows how we can tie a lot of things together in healthcare technology to solve some common issues, right? Like, definitely, I think it's safe to say that workforce optimization is a top priority for many healthcare organizations over the past couple of years, right? Their workforce and the schedule challenges and the the burden that's been placed upon them has almost been like a perfect storm. And so it's a great example. And again, so just to sort of wrap this up, we've got 3 minutes left. So I would just remind folks that we talked about a lot today. We talked about using different layers of technology, database technology, cloud technology, cloud API services to essentially pull together data from across the health organization, and then allowing the decision makers at the health organizations to have actionable insights into that data, and to provide meaningful dashboards that they can use to make decisions, and also make it better for the providers, right? Help them protect their time, help them protect and also, I shouldn't say protect, but calculate things like RVUs, etc. So yeah, this is a wonderful conversation, Brian. Thanks for coming back and talking to the group again. I'd love to do a follow-up, maybe in a couple months. What we could do is do another 30 minutes and actually do a demo of the technology, though, like dive into, what we're doing with the database and how we're collecting some form stuff. So if you're open for that, maybe, we'll have you back in a few months, and we'll do the demo.
I'd love to close with two thoughts, and that would be
Sure.
one, I think on the business side of my mind, because I spent a lot of time in finance. On the business side of my mind, when I think about the amount of money that the United States spend of the gross domestic product in healthcare, right? That's a big chunk. And then the amount of that you spend on providers to provide that healthcare, there's a lot of opportunity there, right, on the business side. The second side of my mind, and really the reason that I love healthcare the most, is because even things like this system where we're driving efficiency across the healthcare system, driving optimization, the fun part of healthcare for me is that it helps the patient. So at the end of the day, we can talk about business and technology and all that kind of stuff, which I love, right? That's a heartbeat of mine. But also we're helping people, right, live healthier and better lives. And to me, that's the end of healthcare. That's the real end of the healthcare game.
I love closing on that message, because as you know, we share a lot of this content in our Discord group for the younger folks that might be interested in getting into healthcare technology, right? Some of them are interested in the operations side and the finance, others on the clinical side and bioscience. So what a beautiful way to end the session. Thank you for that, Brian. And thank you again for your time today. Cheers.